Joining me now is Dr. Panis Vassilotis. He is with Academic Alliance in Dermatology. Thank you so much for joining us today.
Thank you so much for having me. I do appreciate the privilege to talk about my passion, that is finding the melanoma early and caring for our patients in the community. And I thank very, very much all the doctors and the nurse practitioners and PAs who work for Academic Alliance in Dermatology.
So talking about melanoma, melanoma is something that we hear scary stories about. It is one of those diseases that we don't do very well in identifying, and when we identify it too late, we end up having massive issues with it, including death. So let's go backwards. What's melanoma, and what is it that makes it so it's a diagnostic challenge?
I will quote a mentor of mine from the University of Colorado. He told me, Panos, melanoma gives cancer a bad name. So that stuck in my head. As I came to town 20 years ago, I made it a mission of mine to never lose a patient to metastatic melanoma. Along the way, the last 20 years, as I reflect back, I'm able to analyze about 4,000 to 5,000 cases of early melanomas. I can tell you, we have a great track record. We are finding the melanoma very early, and we do that really with a very, very careful history and clinical examination.
So we look at, we got spots, and everybody has spots on their skin. This Florida, so obviously we call them sunspots, we call them age spots, we call them whatever. What makes it so that that one is so specific?
We all have spots. But literally speaking, we have stripes as well. We are embryologically looking at it, we are in a segmentation pattern. So my analogy is, when do the spots become stripes and the stripes spots? What is most important is we identify what is the area genetically and historically which is most prone to develop melanoma, and then we look at it very, very carefully. Clinically, we evaluate for changes, appearance, and we have appropriately applied the algorithm to biopsy. By doing so, our rate of deep invasive melanomas is literally not exceeding 0.01% of the cases. And over the 20 years, when I look back and I do our statistics, we had literally only maybe a dozen deaths over 20 years in clients, in patients who follow up our criteria and came back to us at the regular intervals.
So let's talk about your criteria. So we have the ABCD. We talk about what it looks like, where it is, and all the fun stuff. So expand a little bit on that for us.
Along the way, I was taught the ABCDs in my residency. A for asymmetry, B for border irregularity, color variation, diameter. We refine the criteria and we term them as the EFGHI. E stands for evolution. F stands for family history, and I emphasize history. G stands for genetic history. H stands for history, applying to every aspect of history: family, environment, occupational, social history. And I like that really good. I is for instinct. You have the instinct, you have a sense, the way the patient presents, the demeanor, you have it in your gut, and that comes with experience and the instinct. When we apply, we start with the ABCDs, but we refine that to the EFGHI. We have amazing results.
So when a patient comes and says, hey, doc, take a look at this piece, and the average doc looks at the ABCD and says, that looks okay, what do you recommend that patient do next?
I have seen melanomas that never read the books of the ABCDs. I have seen the most symmetrical, small, tiny, uniformly colored melanomas in my life. Mm-hmm. What counts for me, and is exceedingly important, is really the history of the patient. Family history. Mm-hmm. Look for core malignancies. There is P53 or RAS oncogene, P15. They have been associated and described with 22 different malignancies. So in one patient, that oncogene may be expressed in the pancreas or the lungs and some in melanoma. So all this is very, very relevant. As you know, the DNA in every cell is the same. However, it's expressed differently. Mm-hmm. The same applies with the oncogenes. We have found family pedigrees where the great-grandfather has a lung cancer, the grandfather pancreas cancer, the father melanoma, and the patient colon cancer and pancreas cancer and melanoma. Mm-hmm.
So when we look at these specific lesions, there's a lot of things that come into play. Obviously, we can talk to our family, but a lot of our family don't know a lot about things. We heard that Grandpa Joe had this. We heard that this happened there. What do you recommend to the individuals if they don't have a family history? What do we do at that point?
I will apply the method I applied to my family. Mm-hmm. I reunite our family once a year from Greece, America, and Cyprus. We get together. We have a wine tasting, mm-hmm. and then everybody tells the family secret. And during that time, I built my family tree. And I found in my own family that about 12 relatives, they have moles on exactly the same spot. And I'm not talking about the garden variety sunspots or age spots. Mm-hmm. I'm talking about the blue nevus, which is a very uniform, unique type of nevus. And I found this in 4 generations in 8 family members. Mm.
So like a visual roadmap. So we look at the families, obviously families pass down the genetics as well. When we look at position of these things, then you're saying there's a higher chance that if someone had the same mole over generations, that could be a higher risk?
Absolutely. We have described the whole team, mm-hmm. the whole AAD team, we have described about 60 cases where the melanoma or the pre-melanoma happen at exactly the same spot. Mm-hmm. So, jokingly, I say the family started from the Vasiludis, dots and spots. Mm-hmm. And we ended up to the Academic Alliance in Dermatology melanoma detection approach.
Wow. So family is everything, obviously. Thanks so much for sharing that part. And if we don't know our families, there's always a picture of our family. So if you can see old pictures of the family, perhaps you can see a clue into where you're at currently. The great topic that we have, obviously, can spread into multiple things since derm is obviously the skin, and we can see that it's a visual roadmap, but you're thinking perhaps maybe there's other connections later on. So that's good to know, and people need to understand that. But obviously, at this point, melanoma is something we want to be aware of. We want to make sure that you're taking care of it appropriately and treated early. So thanks so much for joining us today. Great topic, great information, and I'm sure our families will appreciate it in the future.
I do appreciate that so much, and I want to say one more time, when you love your job so much, the family and the team is one and the same.
Thanks.
Thank you so much.
Mm-hmm.